Hopefully we'll be sharing some things with you this afternoon that are going to be useful for you in practice or in your business. And so let's get started, actually. Let me, Teresa, I'll ask you to keep an eye on the waiting room if you don't mind.
Yeah, of course.
If anybody joins us and I haven't spotted them, just let me know and I'll make sure that they can join the session. So let me share my screen. While we're getting started, there is a Sarah, thank you. Sarah said her mic isn't working. Thanks for letting us know, Sarah. No problem at all. That's great. As we go through today's session, if you want to drop anything into the chat box, do feel free. Just, questions, comments, challenges, anything that you're going through. What I'm hopeful in this session, we will finish within the hour. We'll finish about 1 to 2 is our aim. But if there's anything that we go through, you think I'd like a bit more information on that, or don't quite understand where you go with that, then just drop it into the chat, and we'll do our best to answer it and give you some clarity over the different sessions that we or the topics we cover in this session. Can everyone see my screen? Okay.
Yep. Good.
Brilliant. Okay. Perfect. So thanks for joining me in your lunch hour. The idea of today's session is to give you some thinking space. So just an opportunity to kind of press the pause button on everything else that's going on, and just think about what it is you're doing at the moment in practice. And as we go through some of the topics, hopefully you'll start to think, okay, yeah, there's some refinements, amendments and tweaks that I can make to my communication in practice. And that's what we're really going to focus in on today, is communication. And it is about kind of consultations with patients or, customers, depending on your experience and what you're doing either in practice or in your business. And I'm going to share with you this model that we've developed in Focus Growth called the Inspire Communication System. It is a sales model. And originally, it was used in our sales conversations and sales training that we do with businesses and their sales teams. But we've deployed it very successfully in dentistry. So a lot of dental practices are now using it as a communication model for patients. And yes, it involves selling, but it's not really a sales model. It's more of a consultative conversation model, and that's what people find really most engaging about it. And we'll look at how that then helps us to understand what patients need, and that of course makes us more relevant and valuable to them. So that's really what we want to try and focus in on. And then if you follow the process, and I'll talk a bit about the process and the patient journey today, if you follow the process, then it naturally leads you to ask for commitment, and that commitment is what helps your patient get the result they're looking for. Yes, it's good for your practice, but it helps the patient get the result they're looking for. That's why patients come to see you, right? It's because they want the result, they want the transformation, the improvement in their smile. And so I think I've met or had some interaction with some of you, but if you don't know my background, I'll give you a quick whistle-stop tour. I originally started in dentistry, so I was a dental technician at the age of 18, a long time ago now. And then I qualified as a technician, realized it wasn't really for me. So I left the lab and went into dental sales. I was on a sales territory for a couple of years with a retailer. And then I moved into sales with a manufacturer, Dentsply, who at the time were one of the largest dental companies in the world. And I made that move largely because of the development opportunities it kind of had for me to be able to work on my sales approach, become more efficient at communication, and work with a company that provided, that structured development. And that's exactly what happened. So I was with Dentsply for about 4 years, and then I went to 3M. And at 3M, I was appointed as key account manager and manager of corporate. So I started to manage much more strategic relationships, senior people. And then from there, I went into sales leadership, business management, and I had a business career that took me outside of dentistry for about 13 years. And I kind of reached quite a senior leadership position, realized I had a lot of development and was managing large business teams, but also realized it wasn't really what I wanted to do. So about 5 years ago, I pressed the pause button on that, left the corporate world and retrained as a coach, an executive coach. And from there, I've been kind of working with clients, building out programs. I've written a couple of books along the way. And what we've done really is kind of build out a series of programs that we know are going to help, one, with communication, but two, with leadership. So how do you communicate and have a better conversation with somebody that influences them? And how do you lead an organization more effectively? So they're the two areas that we cover. And what we find with the practices and the business teams that we work with is that sometimes you can find over time your results start to drift. You'll get some inconsistencies creeping in, and there's maybe even a bit of negativity in your business or practice. So we just kind of go back to some of the fundamentals, get people re-energized, re-engaged, think about what does high performance look like. That's what drives results. The performance of people is what drives results. I know it sounds obvious. Sometimes we focus on the results without thinking about the performance. And that consistency starts to drive much more engagement and growth. And along the way, we've, our programs, the work we've done has kind of earned us a few awards, which we're really delighted about. And the 2 books that I wrote both became Amazon bestsellers in different categories in the UK. But this one on the right is the one that is for dental teams. So I wrote the first one, Inspire, Influence, Sell, in 2020. We had a lot of dentists read it as well as salespeople. And then I was asked a number of times, is there a book for dentists? So I wrote the book for dentists, and we've had some great feedback on that as well. It's much more than just a book on communication. It really does talk about connecting with people, managing relationships, and growing your practice, and thinking about yourself as, your personal and professional development being a driver for that growth. So if you haven't had the chance to read it, I would say this because I wrote it, but I genuinely would implore you to get a copy and read through it. It will be an interesting read for you, I almost guarantee it.
Which one is the one for dentists?
The white one, Dora, Inspire, Consult, Sell. And you can get it on Amazon, and I would say in all good bookstores, but they don't stock it. You can only get it on Amazon, really. I'm interested. I've got a couple of polls. We'll still do it as a poll because it's fun. I'm just sharing a poll with you, just to kind of give you an opportunity just to say, what is it that best describes your role in your business or practice? Are you a practice principal or partner? Are you a practice leader or practice manager? Are you a business manager? Are you an associate? Are you a TCO? Are you something else? And if you've got other, just put it in the chat if you don't mind. I'm just intrigued, because what we'll try and do is make sure that the content's relevant for everybody that's on the call today. So I think, has everyone had the chance to hit a category? Yeah. Okay. Good. So have I got some? Siobhan, thank you. Dental supplier, and Siobhan K, event organizer. Thank you. Great. Brilliant. Okay. Perfect. So we've got interesting. We've got a real mix on the call today. So that's really good to see. Thank you. So I'm interested in the answer to this question, because I ask this a lot, because it helps us with our research. What would you say is yours or your team's biggest challenge when you think about, so if you're in practice, think about patient consultation. If you're in a business, think about customers. So is it discussing prices? Is it asking for commitment? Is it articulating the benefits of what you do? Is it asking the right questions to discover the needs of your customer or your patients? Or is it about the experience that you create? Which of those would you say is your biggest challenge, either for you or for your team? And if there's something that's bigger than that you think, actually, there's something that's more of a priority for us at the moment, just put other challenges and then just put it in the chat, and I'll try and talk to that today. I'm hoping that we'll be able to cover these topics for you as part of today's session. Okay, good, thank you. So what did you say? You said two main things: asking for commitment, asking the right questions. Asking for commitment, asking the right questions. There was something else. If that something else is important, please drop it in the chat, and hopefully I'll be able to cover it as we go through today's session. Okay, good, thank you. So this is what normally comes up. Interesting, exactly the same as today. Top 2 are the same as today, right? So number 1 usually comes up as asking for commitment to start treatment. That comes up around 20% of the time as the number 1 thing. Asking the right questions comes up slightly behind that, about 18% of the time that comes up as number 1. And remember, asking the right questions is not just about questions, it's about discovering what is it that person needs in order to be completely fulfilled, happy, and engaged in the process with us, whether that's treatment or whatever it is we're trying to work with them on in our business. And then the third one is articulating the benefits of treatment with us, or articulating the benefits of our solution products. So we'll look at those 3 things today, but let's just quickly check in on something that we find really useful. So we've got this tool in Focus Growth called the Patient Experience Scorecard. And this is free of charge. I'll give you a link to this after today's session. And it's a really nice way to get a kind of an assessment of where you are in terms of your consultation and the approach you take. If you're not dealing with patients, we have another tool that does the same thing for businesses. So if that is relevant for you, Siobhan and Siobhan, I'm happy to share that link with you instead, which we'll do after today's session. But the idea with the scorecard is it just starts to create awareness. As you go through it, you answer the questions and it starts to get you thinking about where you might need to change your approach to communicating with patients or customers. So let's look at the three challenges. There are three kind of things that are going on that link together. So asking the right questions links with articulating benefits, which links with asking for commitment. So those three themes that come up time and time again, we reorder them, because if you think about it, that's the order in which you can address them. If you address them in the right order, they kind of solve each other. So we get the first one right, it solves the second one. We get the second one right, it solves the third one, and everything flows. So I'll talk to you a bit about that. So I'll talk to you about it today, and it's how we go kind of deep into it as we look at our programs. So number one was asking the right questions and listening. And it's not just dental teams that do this. If we don't take the time to ask the right questions, and we'll talk about what the right questions are a little bit later on, and listen to the patients, what happens is the patient doesn't get, or the customer doesn't get to express their real needs. And if they don't express their real needs, they don't feel as though they've really been able to kind of unpack for themselves and for you what it is they really need to happen to make the experience optimal for them. So if they just hear you talk about treatment, or you talk about your business, then they don't get the chance to kind of unpack themselves and then join up the dots. So the dots never connect for them. So it's really important. And it really is, if we start to get questioning right, it's kind of half the solution to any of our problems, getting the right questions in place. And we'll talk about how to do that shortly. The second thing then, if you're not asking the right questions, then articulating benefits of treatment becomes difficult, because if you haven't understood the patient's needs, when you present a treatment option, it feels generic, doesn't feel tailored or relevant to that customer or to that patient, depending on the context. And so you can see that the second problem is linked to the first. If you haven't uncovered the needs of the patient, taken the time to listen and question, this part of the process feels very pitchy. And the last thing any of us want to do is pitch our products, because that feels insincere. It feels like, I don't know, it's just, there's a lot of resistance to it. And we feel the resistance to it, and so do you. So understanding the challenges is, and understanding, how do we present it more authentically is really important. What we have to do through our conversations is figure out what interests the patient. We do that through questioning and listening, okay, or customer. We then think about what is important for us to make sure the patient understands as part of that proposition. And then we find the sweet spot between the two, because they don't need to know everything that you think is important. Everything that you or I think is important isn't always important to the patient. Actually, it becomes white noise. And in the face of white noise, people struggle to then make decisions. So you can see how that starts to affect commitment. So then the third piece is about asking for commitment to start treatment. And the challenge here is that if we haven't understood the patient's needs, and then we might have inadvertently, this doesn't happen on purpose, we might have kind of over-talked about the treatment, told them a bit too much, talked about the pain, talked about injections, talked about all the things that maybe make the patient feel a bit anxious. Then we sense that anxiety from the patient, and you might think, I'm not so sure that they're going to go for this. So you don't feel confident to ask for commitment. And if you don't feel confident to ask, you'll either say something like, oh, we'll go away and think about it then. And then the patient goes and they do think about it, but they don't think about the right things, and they make a decision just to do nothing. Or they tend to default and just kind of kick the can down the road. So we then become almost the barrier to our own success in that respect. So if we don't ask, the answer is always no. And we're going to talk about a way to ask, but it works as part of the flow of the process that we have with a patient. So we have this consequence that, as you build this, success breeds success, and challenges breed more challenges. So if we don't get it right, if we don't change our approach to start to get that consistency in the way that we want through our patient consultations, then we get a bit stuck. The business doesn't grow. We kind of do reactive dentistry. We feel like we're just having kind of functional conversation, not transformational. And you can see that actually in the practice and in the business, it starts to impact growth. So we have to make a change, and there's a change in the perspective that we make. And I'll talk you through a couple of things that will be hopefully useful for you. The first is thinking about GDC regulation. So number two, GDC principle number two is communicating effectively with patients. And that, what that means is giving them all of the information they need so they can make informed decisions. And they can only make those informed decisions if we've understood what they needed in the first place. So we effectively diagnose. And it's not just diagnosing treatment, it's diagnosing what the patient really wants and what they're looking for. That's really important, but it's so important the GDC put it as principle number two. And we talk about the patient journey, which is a really useful way to consider, what are the stages the patient goes through in that decision-making process, and what are the stages we go through in our communication process, and how do we line them up so that they're effective for us and for patients. So patients normally start out their journey with us unaware. They're booked in for something, they're not fully aware of what's available or what's possible. And our job is to prepare ourselves, prepare the clinic, prepare our information, make sure our team are informed, make sure that we're informed, so that as we start to communicate with patients, we can start to share examples and start to highlight things for them so that they move from unaware to the first step, which is attentive. So they're now attentive that something needs to happen, whether that's an improvement, whether that's remedial, whether that's a full smile makeover and transformation, but that we have to bring their attention to it in the first instance. Now, when a patient is attentive, our job then is to share some insights with them, to start to share with them information that they don't know, and not overload them with information, but actually share with them things that might just get them to think differently. And very often, products like intraoral cameras, intraoral scanners are great for this, because they allow you to show the patient what they can't see for themselves, or what they're perhaps not fully aware of. And through that insight, you move the patient from attention to interested. So you had my attention, now you've got me interested. And when the patient's interested, our job then is not to pitch and start to talk about the treatment and all the different options and what we can do. It's to ask the patient about their needs. So what is it you're looking for from treatment? Start to question them, listen carefully, let them explain what it is that's on their mind. And the reason we do that is because the patient starts to move themselves. They start to move themselves internally to think about, what does a change look like, and am I preparing myself for it? And as they move forward, they go from interest, as they're explaining it, to creating a desire for themselves to make a change. And when that desire kind of starts to evolve in the patient's communication with you, and you'll sense it because you'll notice they'll start to talk themselves into it, then you can start to talk about treatment solutions. These are the different options. Here's how it works. This is what's possible. And if you choose option one, this is what's possible. If you choose option two, this is what's possible. So you can then start to have a much more informed conversation, but you're doing it at a point when the patient's ready. So they're in this state of desire. It's really important that they're at the right stage in their own thinking. And from there, of course, once you've talked about a solution, the patient's then like, okay, so what do I need to do? How does it work? And they're the kind of key, people refer to them as buying signals. They are buying signals. The patient's now kind of asking you to inform them on what comes next. And so when the patient's asking and is fully engaged, that's when we make a proposal. So this is what it would look like. Here's the plan. Here's, we book you in at this stage. And all of a sudden, the patient or the customer is the one that is inviting you to explain how it works, rather than you feeling as if you're having to tell them. And that's really important, that the patient comes first. We follow and we follow that guidance and what they're telling us through the process. And then, of course, they want to sign up for treatment. That's the idea. They want to sign up for treatment once we've explained the plan. And our job at that final stage is just to initiate something that is concrete for us, concrete for them. It may be a deposit. It may be, depending on your practice and the team structure, it may be handing over to the TCO. It may be just booking in the first appointment, walking them to reception, make sure they get booked in okay. But there's something about just initiating that final step. Because if we don't take that final step, if you allow people to kind of go, oh, well, let me consider it, actually that they would prefer it if we just got them committed to the next stage. And ultimately what we really want is to create loyal patients who not only keep coming back to the practice, but also start to tell their family, their friends, and become kind of advocates, maybe even write testimonials for us, maybe put Google reviews on. And our job is to encourage that through, reflection, through the right conversations with patients, and thinking about, engaging our teams to align with everything we're trying to create in the practice. So we use this as a model that helps you think, right, that's what the patient goes through. Here's how we can align our communication with it. And if you're not, I don't know how much digital technology you're using today, but one of the big things is about trying to help people see and experience a change so that they can then acknowledge that they want to make that transformation. And that's a big thing, whether that's, we kind of talk about the intraoral camera as a great device to do that, because there's a lot of people haven't made that digital journey yet. It's something, I think it's about 75% of practices still haven't made that digital transformation. So we're really trying to help people to kind of think, actually, where does digital play a role in my practice, and how does that start to drive a change in my approach? So let's just look at the Inspire model. So I talked about the patient journey and how the model runs alongside it. That was quite linear. I won't go through every stage in here, but you can see we think of it as a cycle. So we're constantly thinking about how do we improve and evolve this cycle of the Inspire model. And it's a mnemonic. So, I is for insight, N is for needs, S is for solutions, P is for proposal, I is for initiate action, and the RE is the reflect and evolve stage. So it becomes something that you can embed quite easily in the practice, something that you can kind of familiarize yourself with, so you become kind of more subconsciously aware of what's going on and what you're doing as you work through your patient consults or customer conversations. And I like to think of it, I talk about consultative process. I like to think of it as, it's a bit like consultations and coaching are similar principles. When we think about commitment from other people, whether that's patients or our team members, or even, friends and family, depending on what we're trying to get people to do, then actually a lot of commitment has to be pulled from people. And the mistake we make is that we try and push people to do things. And pushing people to do things might get you a short-term result. You might get a small uplift, but actually over time, if you get used to gaining commitment through pulling, through questioning, through coaching, you get much more sustainable engagement from patients and your team. So it's a kind of principle as much as anything to consider. How do we pull and use a question-led approach to get commitment from our teams and our customers and patients? So let's talk about these three things. I talked about problems, talked about the patient journey. Let's talk specifically about how do we handle these three areas. And obviously we go deep into this as part of a program, but hopefully today you can get some insights that just help you think, and you can make some adjustments and changes in your practice or business. So asking the right questions. So where we see this in our model is in the needs discovery stage. It's quite early on. And that's really important, that we think about questions and engaging the patient through questions and listening as early as possible. And at this stage, we have to really think about slowing ourselves down, especially if you work in a busy practice or even a busy business. Everything seems a bit fast-paced. Actually slowing it down, creating some space is really important, because then you can really understand what's going on in your patient's mind. And that's so important, because they're the ones that will be able to tell you what it is that influences them. You can't guess that stuff. They have to be able to tell you. The first thing is about listening. So I won't talk too much about this today, but listening is a skill that has to be developed. And it's one of those things that for a lot of people, especially, as I say, if you're busy, you can kind of find yourself just trying to run through different conversations and almost clipping the words of other people without fully tuning in and listening. So a reminder that listen and silent are made up of the same letters, and you can't do one unless you do the other. So you have to try and create a bit of silence, create a bit of space, and tune in and listen to your patients. And once you've tuned in and listened, then it's about asking the right questions. And we talk about three types of questions that are really important to distinguish. The first is open questions. And these are open questions that get people talking, allow them to explain, expand on their thinking. Then we talk about probing questions. So these are questions that you might have gotten, some information from the patient or the customer, but actually you need to know a bit more. You need to delve a little bit deeper. So you use probing questions to do that. We've got a couple of simple structures that help you to probe effectively. And then we ask closed questions. And closed questions, as I'm sure you'll know, they can only be answered yes or no. But what's interesting is throughout my career, and I still see it a lot now, people default to closed questions. So you will unconsciously be asking a lot of closed questions in your business with your customers or patients. It's a natural phenomenon. So actually changing the way that you ask questions and changing your question structure is really important, because as we think about the patient journey, and this could equally be a customer journey, but if you think about the patient journey, early on in the process, we should be asking open questions. So get the patient talking, establish rapport, get the relationship flowing, and get the patient to be able to process what they're thinking. Once we get to talking about needs and solutions, then we should be probing. So what specifically is it that you're looking for in this area? What specifically is important? Tell me more about how you're thinking about that, or what you're looking for. And that probing approach really helps the patient to get clear on the result and the outcome they're looking for. And of course, all of that is information that allows you to better serve them and make a more accurate diagnosis and treatment afterwards. And then it's only towards the end of the consultation that we should be starting to ask closed questions, where we might be looking to check that they've covered everything and ask them, are you ready to move forward? Would you like to proceed today? So the closed question helps you get that commitment, helps your patient to make that commitment to themselves as well. So that's kind of questions and where it sits, or our advice on asking the right questions. So hopefully you're starting to think about this for your own conversation with customers and patients. And then the second area is about how we articulate the benefits of treatment. So we ask the right questions, the patient or the customer's given us the information that's most relevant for them, most important for them. And then it's about how we articulate the benefits of what we can do for the patient. And in our cycle, this is the solutions discussion. So how do we discuss a solution with impact with patients? And if we don't get this part right, it's interesting. What we find in businesses and in practices is that if you or your team can't articulate value, and we'll talk about how to do that, we find that cost tends to be a greater priority. So people focus on cost when they don't understand the value. That's what we've learned in the work that we do together. So we have to be able to create value for patients. And we do that through 3 steps. So we talk about 3 components to whatever it is you're offering: the feature of what you're doing, the advantage of it, and then the benefit. And what it means for patients, features tend to be trivial. So if you put it into context, if it was like clear align or Invisalign, you might say it's a clear material. Actually, so what? Unless you can explain how that's a competitive advantage, well, it means you won't have brackets or wires being shown to anybody during your orthodontic treatment, for example. And then the benefit, what it means for them, you said earlier that you were looking for a treatment that was discreet. You didn't want everybody to know that you were in orthodontic treatment. So the benefit for you is nobody needs to ever know unless you tell them. So all of a sudden, you've got 3 ways to position a service that you offer. And it starts to resonate with patients much more effectively, because you're linking what the product does, how it's an advantage, and the benefit that they gain personally from it. And that's so important to connect the dots. And one of the other ways to do this, or one of the ways to complement this, is also to think about before and after catalogs of images. And we highly recommend thinking about building your library of before and after images for your patients. And also, of course, and it sounds obvious, but it's amazing how many people miss this, making the before and after relevant to the patient in front of you. So if you've got a male patient, make sure the before and after is a male before and after. It's a female patient, make sure the before and after is female. It's amazing how many people don't get that right. And think about the other factors, age. We talked about gender, ethnicity, the type of dentition. It's about showing people something they can relate to and think that is me, or it's similar to me, because that has real power for them as part of that process and that conversation. So benefits of treatment, there's a part around articulation, there's a part about preparation and how you prepare yourselves in the image library that you have for patients. And then third is about asking for commitment. So you can start to see, if you build this out and you ask really great questions of your patients, you're listening carefully, they're explaining to you what it is they're looking for from treatment, you can summarize that back to them and they're kind of agreeing. So they go, yeah, this person's understood me. Then you start to talk about treatment, you talk about the options, you share with them some examples and they say, okay, yeah, that looks like what I'm aspiring to get as well, and you're able to link it back to what they told you they need, then it's about asking for commitment. So you follow those stages and all of a sudden it flows. And the patient, very often, if you follow these steps, they may even be the ones asking for commitment. They may be pressing you for how quickly can we get this done, which is a great position to be in, right? But if that doesn't happen, we call this the proposal agreement stage. Then really what we recommend, if you follow these steps, is that we use what we call a pre-commitment question. What does that mean? What it means is that rather than saying, would you like to proceed, and risking the patient saying no, then what we do is we ask a question that creates a small gap that allows the patient to give you feedback before you ask them for commitment. So let me show you an example. Actually, it's more simple than it seems. So an example of that question might be, is there anything else we need to cover before we agree the treatment plan? So it allows your patient space to say, well, actually, I'm not sure about this, or you haven't explained that yet, or I asked about this and I don't understand how it fits with that. So you've got this space that you create where you can then address that concern that the patient might have, or the other important point for them. And once you've done that, and then you can check again and say, so okay, so you're happy that we've clarified that. The patient says yes, then you can say, so are you ready to move forward? And it feels really natural. It feels natural for you. It feels natural for the patient. But this pre-commitment question is what opens the door for you to feel confident to then ask for commitment. And it's like a mini stage. It's really useful. And we found, if you apply this consistently, you'll find that you just feel more comfortable asking. Patients will actually give you more information, or they'll just say yes. So if you say, is there anything else to cover? They go, no, actually, it's fine. I think we're ready to move forward, which is really useful. Gives you a structure to follow. So that is kind of almost the end. And then we say, enthusiasm has a half-life. So for your patients, if you don't then, even if they say yes, if you don't then kind of encourage them, okay, so let's get you booked in, or actually what we recommend is that you put down a deposit so we can secure your next appointment. If you don't go to that stage, people can still then go, oh, something's come up. Oh, there's something else pops up that just delays it. So we always say that final stage, enthusiasm has a half-life. While someone's in your presence, they're enthusiastic, then we should make sure that we're able to get the commitment for them and for us at that point in time. Okay, I'm just going to pause for breath because I've been going for about half an hour, I think, and just take some feedback. I'm intrigued. What do you think so far? What have you been? You've been furiously taking notes, I've noticed. What are your key takeaways from this session so far? You can either come off mute or you can drop it into the chat. Well, it depends how brave you're feeling, I suppose.
I guess it's better to have a structure to what you're doing as opposed to just freestyling.
Yeah. Thank you, Dora. There is something about freestyling it, though, isn't there? It's fun.
And then this last one about because that's what I find so hard. You finish your spiel and then you're like, you don't want to be pushy, but like, when they're like, should I get you to book? And they're like, no, I'll ask my husband, or do something else. And you're like, oh. Then you lost them and you don't know why or what you could do different.
Yeah. So how often do you find that happens, Dora?
Like 20 to 30% of the time, I guess. Okay.
20 to 30%. Okay. So what do you do today to handle that? Well, how do you
So, is there anything else we need to cover before we agree? And just assume that they'll agree.
Yeah.
As opposed to that's.
So you're going to change that going forward.
Yeah, and the other thing I find hard, when we talk about the feature, advantage, benefits, is nowadays, especially we talked about clear aligners and Invisalign, Tom, Dick and Harry is doing it. How do you really say why it's you, not them, you know? If people are price shopping, but I don't have the answer to that. I'm just kind of having that.
I think one of the answers, Dora, is that if they are price shopping, what they're really looking for is the right option. So if they're in front of you in the chair or in the clinic, then they think you're one of the right options. So actually, the thing that's going to convince them is the conversation you have with them about what they're looking for specifically.
Mm-hmm. So point number one.
Right the way back to point number one. That's the answer.
Mm-hmm.
And even exploring that. So if they say, oh, well, I'm shopping around. Oh, that's great. I think you're right to do that. So what have you found out so far?
Mm-hmm.
Let them tell you. Oh, okay. So and when you think about making, a decision on treatment, then what is it that you're looking for that will help you know it's the right option? And they'll tell you. And they might say, well, I'm shopping around because of price, right? If they say I'm shopping around because of price, then you might say, okay, well, that makes sense because it's a big investment. Assuming that all the prices were the same.
Ooh.
What else is important for you to consider as you make that decision about treatment?
Mm-hmm.
Because price is never the one thing. Never, ever, ever the one thing. If it was the one thing, then, Rolls Royces, Ferraris, Bentleys, BMWs, they wouldn't exist. Everyone would be driving around in a Ford KA, right? It's never the one thing. What is important to people is the experience they have, what they think they can tell other people, and whether or not I think you're a fit for me. And if one of the big things that helps people move like that is, do I like you? Do I think you'll do a good job? Have you been interested in me? Have I had the chance to talk about what I want? Have you made something that sounds like it's specifically for me in the conversation? And if you do that, everything changes.
Yeah, that's very helpful, actually.
That makes sense. Yeah.
Yeah, that last question, assume all the price is the same. What else is important? What else is important for you? That's kind of.
So you almost you can't say, but just put price over here for a minute and tell me what's really important.
Yeah,
because it won't be price.
Mm-hmm.
Yeah, it won't be price.
That's amazing.
Pleasure. Just one of the things, Dora, there's so many kind of elements to it, because there'll be things that even when you do that, there'll be things that come up then after that, and you're like, oh, how do I handle that bit then? So there's loads of ways in which you can just start to refine the communication approach, get some, additional kind of, it's all fine tuning, isn't it? It's all fine tuning. So that's kind of what we try. Hopefully what we try and help you do is that continuous fine tuning of the consult, so that your 20 or 30% who sometimes you think, oh, how do I get those people to commit? We can actually start to build a really strong structure for your consultations that helps you get really confident, even with those 20-30% of people that might feel like sometimes you're not quite sure where to go with. That's good. Thanks for the question, Dora. That's good. It's really good.
No worries, because a lot of people are blown by the experience, and they're like, it's just the some people who put the price in front of them, and they're not really, you know what I mean? The harder to convince ones is the harder.
And there's lots of ways to kind of position it. That the one where we take price off the table. So if they were all there, if everything was the same price, if everything you looked at was the same price, what else is going to be, what else is going to, are you considering in terms of making the decision, right? So that's the nice question. The other question, if somebody says, well, the price is higher with you, then you might say something along the lines of, so always move from price to investment, okay? So your investment in this treatment is your investment, because when you say the word price, people think they have this loss aversion with the term price. When you say investment, we have this gain kind of association. So we think when we're investing in something, it feels like it's a gain. When we think about cost or price, it feels like a loss. So that's just an interesting psychological factor. So we just always use the term investment. but you might say, the investment in treatment with us may be higher. Out of interest, what are the things that you would be looking for that would make that investment worthwhile? And they will tell you, well, I'd have to be confident that I was getting this. I'd have to be confident that that was happening. So all of a sudden you have a way to just almost manage that objection, and the patient's the one that tells you how to manage it, because they'll tell you. Cool. So there's lots of different ways in which you can start to refine the communication approach.
Thank you.
Good, thanks, Dora. Siobhan, anything that is on your mind?
Sorry, come off mute.
That's okay.
No, I think that was really good, Justin. Just the I think yeah, I don't know, there was lots there, to be honest, but the listening and being silent is, I've written that down. I kind of like that, just be silent more and actually let the person talk and tell us what they're looking for. It's quite good. Yeah, nothing extra. I thought really good. I enjoyed it. Very good. Good. Thank you, Siobhan. Thank you, Dora. That's great. So anything else that you want? Anything else that you're thinking that you'd like me to cover today? Before I've got a couple of things I just want to share with you before we close. But anything else that's on your mind that you think I wish you'd cover that?
Sorry, it's me. But
go on, Dora. Go on.
Remember where we talked about this price thing? So yeah. I'm just thinking about the last patient I lost. Yeah. And he came in to us first, acknowledged we were higher. He was keen on all the things we were doing. Yeah. I'm going to go somewhere else to check them out. And then he went with them. And I feel like, what could we have done differently to, you know what I mean?
What did he tell you? What did he tell you he was looking for from treatment?
It was an Invisalign case. He just said he's so mild that he doesn't think it's worth that much money, is what he said.
He said what his case is so mild.
Yeah, because it was true, to be fair. Like he wasn't that crowded, so he was kind of saying he doesn't really feel like paying this much for it is worth it, even though we do dental monitoring, blah blah blah, all the other things. He just didn't see the value in it, I guess.
Okay. What was what are some of the questions that you asked him, Dora?
No, that's the difficult one. I didn't read my TCO.
Okay, because that's the trick, or the trick, not the trick. That's the most important point. Is that conversation with the patient, so even in a mild case, if it's a mild case, there's a reason that person's there. So to kind of understand, what is it that's motivating you to want to make a change, and what difference do you think that's going to make to you, and be able to kind of let him really explore in his own mind, why is he there? The price is always going to be a consideration. Do you mind me asking, what was the price difference between you and the other practice he chose?
I don't know, because we asked him if he wants to come back and talk to us, but he wouldn't pick up the phone. He just WhatsApped, you were more expensive. That's all he said. So I don't even know how much the other one did cost. So
okay.
So I don't know exactly what it was, because I don't know what I don't know anymore, basically.
Okay. I would definitely, so if you've tried these other steps, asking the right questions, listening carefully, and maybe when someone says, I want to go away and try it, you might say, do you mind me asking, what are you going to compare? What are the different things you're comparing between, what we've talked about today and what you're looking for? Because I'll tell you, and he might say, well, I'd like to have a look at the price. And then you might say, okay, that, and I think we should always be positive about that. I think you're right to consider it. It's an investment. If you respond any other way, you look defensive. So I think it's always best to say, it's an important consideration, but then don't be afraid of that price objection. Be able to say, I think the question that I use is, what would make that additional investment with us worthwhile for you? And there's always something, right? Because people are always, well, I want a 100% guarantee that it was going to look exactly how I want, or I'd want, I don't know, there will be something where, because when we're all purchasers of products, when you have two options and one's more expensive, there are things you can do to talk yourself into it. And what you want to do is get the patient to talk themselves into what it will take for them to make that higher investment, because they know what it takes. Like we all know what it takes, but we can't, I can't tell you, because they'll have to tell me. You can't tell them, Dora, because they have to tell you. So asking the questions is really important. So what is it that would make this investment worthwhile for you? Or a question along those lines. But have that in your, if you get whatever that question is, have that question as part of your, standard approach, so that when it comes up, you're like, okay, I know how to handle this, because I've got a question in the bank that allows me to get that feedback from the patient, so I feel more comfortable about it. And they'll tell you, and then once they tell you, you might say, you just repeat back to them. So what you're saying is, if we could do this, and if this was part of it, this was part of what we offered you, then you'd be confident to make that investment with us. Yes. Okay. So what do you think? Would you like to proceed then?
Yeah, so don't let them kind of go, because then they have some other experience, and then that person, they'll get sucked into their thing.
Yeah, exactly. Yeah.
Which is what happened.
Yeah, there you go. And you won't win, none of us win 100% of our customers or patients. You won't ever win 100%, but you will, for the 20 or 30%, that will slim right down to 5 to 10%.
I mean, you did have some that went to somewhere else and said, okay, you knew what you were talking about, but they didn't.
Brilliant.
Those are the ones I did.
Brilliant.
Yeah,
and that's really nice feedback, because that's telling you you're doing the right thing, Dora. That's good. That's really good.
Sorry.
Okay, excellent. So thanks for the engagement, Dora and Siobhan. That's really useful. So let me just, I'm not going to share everything, but I will share a couple of things that could be useful. So I'll talk about our Practice Growth Academy just for a moment, because normally what people say to us is, love that session. If we wanted to go deeper into the topic, if we wanted to, kind of make it more relevant for me, my practice, and all of the different types of treatment, what would happen? So this is our kind of flagship program. So it's the full consultative sales program. It takes 2 days, and we run through it kind of step by step. All the way through the models that you talked about. We go right the way back to, okay, how are you thinking about your consultations? What mindset are you taking into those conversations with patients? What are the key challenges you're facing? How do we make sure that throughout the 2 days we address those challenges? And the way that you're communicating, we give you the chance to practice and role play. It's really useful. So the way it works is we start with, you may already have taken the patient experience scorecard. We'd recommend that as a starting point. So we have this scorecard, which I talked about earlier, that gives you these points you towards your development areas around your consultations, makes you think about, the changes that you might want to start to make. You get some specific recommendations in that report. Then we have a launch call first. We bring everybody together that's coming on the course. We have a launch call first in an evening the week before the course. Then we have our 2-day training course, including accountability partners. So we align you with one other person on the course that's going to help you with accountability and implementation. We give you copies of the book, and both digital and paperback copies of the book. And we enroll you in our online program, which has all of the content on it in short kind of 10-minute video segments. So if you want to, after you've done your 2 days together, if you want to go back and look at any of the content, you've got access to an online program that covers every part of the program. And we use this really useful Excel document called the Inspire Toolkit for Implementation. So it's an electronic toolkit. You capture all of your notes, everything that you're working on throughout the 2 days, and that becomes a document that you can then attach and send to other members of the practice team, or for your own reference. It's really easy to store and keep hold of, because we find that with training manuals, they tend to get put on a shelf and no one ever looks at them again. With an electronic document, it's really easy to communicate. You can have it in lots of different places. and we've got some of the templates that you can print out and then you can make notes on in the surgery, so they become something that you can actually refer back to really easily. And then we follow up with a couple of what we call coaching web classes. So 2 90-minute Zoom calls where we bring the whole group back together and we give you the opportunity to come back and tell us, what's working, what still needs refinement, and you get some coaching around that as well, so that you've got this additional support beyond the 2 days together. We found that's a big part of what makes it more effective in practice and for implementing. And then beyond that, we have options for kind of mastermind coaching groups, and we do a lot around leadership as well. So we have some leadership development programs that can be a follow-on from our Practice Growth Academy for consultative selling. So the scorecard is on this link here. We'll send this to you afterwards, but feel free to connect and look at the scorecard. I'm going to pause on the presentation there because I don't want us to run over time, and it's lunchtime. I know perhaps some of you haven't even had lunch yet. So I'm going to wrap up and say, if you've got any final questions for us before we finish today, Dora, Siobhan.
No, thank you.
No. Okay. Yeah, Dora's got. I knew you would have, Dora. Brilliant. I love it. Dora, I want you on my courses because I like lots of questions.
Yeah. Is this just for patients, or are we going to talk about how we can get the communication better in the team as well? Because I find that important too.
Yes, the team as well. Yeah. So that you saw the model, the Inspire communication model that we use. It's really useful for patients, but it's also useful for team members as well. So having conversations with the team, aligning them with the way that you engage the team and the way that they engage patients. So we really encourage that kind of sharing of best practice, sharing of information with your teams back in practice as well. So you'll have a chance over the 2 days to think, okay, yes, this applies to my patient consultations, but actually how am I going to use it as part of my communication with my team as well? Yeah.
And is that something I should bring, like a practice manager or a TCO to, like, you know what I mean? Who's this for? Like, who should?
Yeah. So dentists, therapists, hygienists, practice managers, and TCOs are all attend the course. So we encourage everybody in the practice team to join us. If you are able to get them, enrolled and on board, that is the ideal. The more members of the team that come, particularly those that are patient facing and impact the consultation, or are leading teams that do, then that is the ideal person for the course. Yeah. Dora, final question, Dora. We have our next course is the 5th and 6th of July. I don't know whether that's something you'd like to consider.
Where is it?
It's in Cambridgeshire. Do you know Cambridgeshire?
Mm-hmm.
So we're in Cambridgeshire, which is we're hosting it at the Actian head office. Mm-hmm. So they are based. It's in Cambridgeshire. It's about an hour north of London.
Mm-hmm. Yeah, I am free.
Are you? When's it? So that's 5th and 6th. Should we get Teresa to give you a call and talk about the details?
Mm-hmm.
Yeah. Great. Thanks, Dora. Siobhan, love to hear feedback from you. Siobhan, you're not a dental practice.
No, supplier. No.
Okay. Cool. Well, let's. I'm happy to catch up with you, Siobhan, if it's useful.
Yep.
So, what do you supply, Siobhan?
I'm with Henry Schein.
In Ireland.
Oh wow. Yes.
Siobhan, can I have a catch up with you?
Of course.
Yeah, I'll drop you a quick mail.
Yeah, for some reason it went to my. I set it up, I thought, with my work email, but it came through my personal. But I will share with you my work email, and absolutely, Justin. Yeah. Yeah,
great. Let's have a catch up. Brilliant. Thanks, Siobhan. Appreciate it.
Great.
Thanks for joining us, Dora. Siobhan, thanks so much. Siobhan, also say thank you to the other Siobhan as well.
I will.
And I hope you have a wonderful rest of the afternoon and a great weekend. And I look forward to seeing you soon.
Thanks very much.
All right.
Catch up with you later.
Thank you.
Bye-bye.
Take care, everyone.
Bye.
See you.
Bye.
Bye.